Iya, baik. Salam sehat, Sobat Espos ya. Berjumpa kembali tentunya dalam Solopos Talk Show virtual bersama Parkway Cancer Centre Singapura. Dan tentunya bersama saya, Rizal Palevi, yang nanti akan menemani tanya-tanya nanti ya mengenai tema hari ini, jangan biarkan kanker prostat ganggu usia terbaik Anda. Dan nanti kita akan ditemani dan juga dijelaskan langsung oleh ahlinya, yaitu dengan Dr. Wong Siew Wei, yaitu dokter konsultan senior onkologi medis di Parkway Cancer Centre, yang beliau juga praktek di Clinical Hospital dan Mount Elizabeth Novena Specialist Center, dengan minat dan keahlian beliau utamanya yaitu di genitourinary, yaitu mengenai sistem reproduksi dan sistem kemih seperti kanker prostat, ginjal, kandung kemih, selain itu gastrointestinal dan paru-paru. Dan tentunya kalau kita membahas mengenai kanker prostat, bahwa penyakit ini menjadi penyakit kanker kelima yang paling umum terjadi pada pria di Indonesia, di mana bahkan dari datanya pada 2020 jumlah kasus baru penderita kanker prostat mencapai 13.563 orang, dan sebagaimana dilansir dari data internasional Agency for Research on Cancer WHO, angka ini signifikan bertambah di tahun 2021 atau satu tahun berselang menjadi 25.012 orang. Dan nanti kita akan tanya-tanya lebih detail mengenai mungkin bahaya pengobatan pencegahannya, tentunya bersama Dr. Wong Siew Wei dari Parkway Cancer Centre. Baik dok, selamat siang. Bagaimana kabarnya Dr. Wong Siew Wei?
Kabar baik, terima kasih.
Kabar baik, terima kasih Dr. Wong Siew Wei ya. Tentunya kita akan membahas sesuai dengan temanya, dokter ya, mengenai yaitu di mana jangan biarkan kanker prostat ganggu usia terbaik Anda. Kita mulai dari pertanyaan pertama, dok, bagaimana mengenai penyakit ini? Siapa saja yang sebenarnya beresiko menderita kanker prostat dan apakah mereka laki-laki yang sudah tua saja sebenarnya?
Okay, every man is actually at risk of prostate cancer, and depending on the population that we are talking about, we have data from America. 1 in 8 can have prostate cancer in their lifetime. The risk of prostate cancer increases as men get older, and in fact, about 2/3 of cases were actually diagnosed in men after the age of 64. The other strong risk factors for prostate cancer include having family history of related cancers such as prostate cancer, breast cancer, and ovarian cancer, or having a known inherited genetic mutation within the individual. And with this, I refer to genes such as BRCA2 gene, which is probably more well known as a breast cancer gene, but it also increases the risk of prostate cancer. Up to 25% of men will have prostate cancer in their lifetime if they carry this gene. The people with underlying genetic mutations tend to present at much younger age and has much more aggressive disease.
Baik dok, tentunya dengan pernyataan yang tadi bahwa setiap laki-laki tentunya memiliki resiko terkena kanker prostat ya, bukan usia yang tua saja. Tapi kalau dibilang kanker prostat biasanya yang diderita oleh laki-laki di usia terbaik mereka 40 hingga 50 tahun, apa yang terjadi pada prostat laki-laki di usia tersebut?
Okay, as I mentioned earlier, majority of prostate cancer patients were diagnosed after they older than 60 years. But there is a small group of patients who are diagnosed at much earlier age, and potentially less than 50 years old. In this group of patients, typically they have some underlying inherited genetic mutations that runs in the family. They may be the first person in the family with prostate cancer identified. Sometimes family history is a bit hard to appreciate, especially with small family tree. Now, if we look at all prostate cancers, I think overall less than 5% of cases can be explained by underlying genetic mutations. So for patients with young age at onset, we will definitely encourage patient to explore genetic testing.
Baik dokter, mengenai kemungkinan terkena penyakit kanker prostat yang mungkin lebih sering dialami di usia yang sudah tua, tapi sebagian juga di usia-usia di kelompok kecil sebelum 50 tahun juga ternyata sudah mengalami gejala dari penyakit kanker prostat. Nah ini mengenai pertanyaan selanjutnya adalah bagaimana cara kita untuk deteksi dini untuk menjadi faktor resiko karena kanker ini tidak memiliki gejala pada stadium awal, dan kapan dan pada kondisi apa kita harus waspada dan harus melakukan tes.
Okay, with any cancer, early detection is very important to allow the best chance of cure. As you mentioned, most patients with early stage prostate cancers do not have symptoms. And by the time they have symptoms such as bone pain, the cancer usually has spread to bones and is not curable. So with that, the focus on cancer screening is very important. For prostate cancer screening, healthy men without any symptoms, aged between 55 to 69, should consider a blood test for prostate-specific antigen called PSA once every 2 years. Those with higher risk of developing prostate cancer because of underlying family history of cancer or non-inherited genetic mutations, they should have a much more individualized screening strategy starting at a much earlier age because their onset of prostate cancer can be as young as in their 40s. They should discuss this with their specialists.
Baik dok, ternyata memang penting ya untuk mengetahui tes sendiri di mana di usia 55 hingga 69 tahun, pun sebenarnya tes yang lebih cepat juga lebih baik seharusnya dok ya. Dan tentunya mungkin ini nyambung juga pada pertanyaan berikutnya bahwa banyak laki-laki yang khawatir begitu mengetahui level PSA mereka yang meningkat dan menemui dokter untuk menurunkannya. Dan lalu sebenarnya pada level berapa kita harus khawatir dan tes apa yang seharusnya dilakukan?
Okay, so it is important for the public to understand that PSA blood test is not a perfect test to diagnose prostate cancer. If we look back, PSA is actually a protein that's made by any prostate cells, even the healthy prostate cells. Any condition of the prostate, such as infection, inflammation, any enlargement because of age, or trauma because of riding a bike for many hours, can lead to some degree in rise in the PSA level. For my practice, to reduce this false positive issue, I usually advise men to avoid rigorous exercise or sexual activity for a few days before doing a PSA screening test. Now, we also need to understand that there is no specific cutoff for PSA level that can put patients into the normal or abnormal range. The acceptable PSA level changes with age. For young patients, we will have much lower threshold for normal versus abnormal, versus someone in the 80s, we will have a higher cutoff in general because of larger prostate when men lives to 80 years old. Now, when we have abnormal PSA level, the first thing I will do is usually recommend a repeat testing in a few weeks' time. And if the level remains raised or even higher, these men should consider undergoing extra imaging, extra scans such as MRI prostate. If the MRI prostate shows suspicious findings, then they should move on to a prostate biopsy. Additionally, I would also strongly recommend any man with PSA more than 20 or a biopsy findings of very high-grade cancer or MRI scan that showed higher stage cancer to undergo additional scan called PSMA PET scan to accurately stage the cancer before any treatment plan is being made, actually. In terms of what to do to bring down PSA level, my advice is the number itself is not the end point. It's like asking doctors what to do to bring down high fever. We would like to understand what's causing the fever instead of just giving Panadol to treat the fever. So there are drugs that can bring down PSA level, but it doesn't treat cancer if there's actually cancer causing the high PSA. So investigations and workup is more important than anything else.
Okay.
I just add on, there is no specific PSA cutoff to decide what to do. So for a young person, let's say 50 years old, if you have a PSA of 6 or 7, in fact, I'll be very worried. And I would think about recommending MRI scan to investigate further. Versus someone age 80 years old with a PSA of 5 or 6, I would be a lot less worried. I may watch him for a few months to monitor the PSA trend.
Oke, baik Dr. Wong Siew Wei. Tentunya dari level PSA ini sendiri, ini tidak hanya berfokus pada tingginya saja, tapi mungkin yang disebabkan juga mungkin bisa usianya ataupun dengan aspek-aspek yang lainnya. Namun meskipun memang level PSA-nya ini mungkin tinggi, ini ada data dok ya, yang menyebutkan bahwa di Indonesia angka kejadian kanker prostat cukup tinggi, yaitu 11 dari 100.000 laki-laki menderita kanker prostat dan merupakan salah satu jenis kanker yang mematikan pada laki-laki. Namun dengan metode dan teknologi yang kita miliki, ya sebenarnya dapat disembuhkan. Nah, di luar sana ada beberapa pasien yang menolak untuk operasi karena takut. Kalau menurut dokter seperti apa?
Okay, early prostate cancer is actually highly curable, and the treatment has improved significantly over the years. The two main treatment options are either surgery or radiotherapy. In some patients at much higher risk of relapse, we may even use combination treatment, including the use of hormone deprivation treatment. Now, when we talk about surgery, it has also evolved significantly over the years. From an old-fashioned open surgery with a long scar and significant blood loss to keyhole surgery, much more or less invasive. And in many advanced centers, especially in Singapore, this keyhole surgery has evolved further, and routinely the surgery is done with the assistance of robotic arms actually to further reduce complications rate from surgery, allow rapid patient discharge after operation. With regards to radiotherapy, the technology has also improved significantly, and in recent years, the routine use of so-called intensity modulated radiotherapy, IMRT, where beams of X-rays from multiple angles are focused onto one clearly outlined area, is able to deliver very good dose of energy to kill cancer cells. Very soon in Singapore, we will have the technology of proton therapy, and this allows even better delivery of energy with less side effects to surrounding structures. And proton therapy, I anticipate, will be a very helpful treatment for patients with large bulky tumor who are at risk of more side effects.
Oke, baik Dokter Wong Siew Wei ya. Jadi sebenarnya itu kalau ngomongin soal pengobatan sekarang sudah jauh lebih maju ya. Harusnya tentunya pasien atau penyintas ya, mungkin mengalami penyakit tersebut sudah nggak perlu takut lagi karena sudah sangat pesat gitu kemajuannya. Nah, tentunya ini di mana untuk menyusun rencana pengobatan, dokter perlu mempertimbangkan usia, nah kondisi umum pasien dan faktor komorbid. Nah, bagaimana pengobatan pasien kanker prostat? Apakah ia efektif dan terjangkau?
Okay, I've mentioned the options of surgery and radiotherapy earlier as options to treat prostate cancer. Both options are actually equally effective in treating early prostate cancers. Having said that, they have different side effect profile. For surgery, there is a small risk of urinary incontinence and erectile dysfunction, which can happen immediately after operation. On the other hand, patients receiving radiotherapy may encounter irritation to their bladder initially during the treatment, including urinary urgency and painful urination. But they are at much lower risk of urinary incontinence, and usually it happens at much later stage. So with regards to treatment options, even for elderly men who are frail with multiple health issues, there are always some options that we can think about. We can lean more towards a non-surgical approach for these people, and the outcome is generally just as good. Obviously, each treatment will have their own costs involved. The more sophisticated treatment will be more expensive in general, such as robotic surgery and proton therapy, but the choice needs to be individualized.
Oke, baik. Terkait dengan pernyataan dengan sebelumnya, Dr. Wong, di mana sekarang treatment semua sudah efektif, tentunya dengan pertimbangan usia sudah tidak perlu khawatir lagi untuk para pasien yang mungkin sudah tua atau mungkin juga terdapat penyakit penyerta juga. Nah, ini berlanjut dok ke pertanyaan berikutnya mengenai kanker prostat. Sebenarnya kan bermacam-macam tipe dan tingkat keganasannya. Apakah Dr. Wong bisa menjelaskan prognosisnya seperti apa?
Okay. Almost all the prostate cancers that we encounter in our clinic is adenocarcinoma. However, occasionally there may be other subtype of prostate cancer rarely seen, such as the small cell type or urothelial type, and these are a lot more aggressive and treated differently. When we talk about prostate adenocarcinoma, which is a common type, there are additional features that will help us prognosticate even patients with early stage, and these include their cancer grade called Gleason score, cancer grade, cancer stage, their PSA level at diagnosis. All these will put patients into different risk category to very low risk, intermediate group, high risk group, or very high risk group. And depending on which group patients fall into, treatment plan will be individualized. Patients in the very low risk group, they don't even need immediate treatment. They can be safely monitored closely for any progression of their condition before treatment needs to be started. Whereas patients in the intermediate, high, or very high risk group should discuss upfront treatment to be started at diagnosis. Overall, the outlook for patients with early stage prostate cancer is excellent. The cure rate is quite high, and only a small group of patients may relapse, typically those in the high risk or very high risk group. Even in those patients who relapse, their 10-year survival still remains very high, in excess of 95%.
Oke, jadi berbicara mengenai memang faktor atau tipe dari kanker prostat ini bermacam-macam ya dok ya. Nah ini mungkin juga mengacu pada parahnya juga atau penyebab-penyebabnya juga. Nah, ini ada juga beberapa yang bilang bahwa kanker prostat dapat menyebabkan kehidupan seksual seseorang itu berakhir dan mungkin mulai mengompol. Apakah itu betul dan apakah kita dapat menghindari radiasi?
Okay, when we talk about surgery or radiotherapy, both actually carry some risk of damaging the tiny nerve that runs on the side of the prostate, which control erections in men. If these nerves are affected, obviously sexual dysfunction can happen after treatment. The chance of preserving erectile function after treatment for prostate cancer is influenced by things such as the patient's age, what is their pre-treatment sexual function, and whether a nerve-sparing approach is possible in the context of a smaller cancer. Younger patients have higher likelihood of achieving erections after surgery, but it often takes a few months up to 2 years after surgery for spontaneous erections to return. For patients who receive prostate radiotherapy, the erectile dysfunction only be obvious after a few years post-treatment completion. Now, in some patients with high-risk prostate cancer who receive additional treatment with hormone deprivation therapy injections, these injections actually lower testosterone level in men and may further compound reduced libido and erectile dysfunction. Having said all this, there are certain ways that may improve sexual dysfunction in men undergoing prostate cancer treatment, and it's quite important to discuss this with their urologist. Now, with regards to the second part of the question on urinary incontinence, most men who undergo surgery will encounter some degree of urinary incontinence immediately after surgery, but this tends to improve after a few months and some pelvic exercise. For patients treated with radiotherapy, they may experience a different set of symptoms. They may have urinary urgency or painful urination, which improve after a short period of time. And a small minority may encounter urinary incontinence as a late complication a few years later.
Oke, Dokter Wong, ini berkaitan juga setelah mungkin pasien sudah melewati macam-macam pengobatan, sudah melewati diagnosa juga, sudah periksa juga intinya, Dok ya. Ini kami mendengar bahwa beberapa pasien yang didiagnosa kanker prostat pada awalnya mereka tuh menyangkal karena merasa sehat, sehingga dia juga menolak untuk berobat. Nah, apakah yang akan terjadi pada pasien tersebut jika mungkin ya ada penolakan seperti itu, Dok?
Well, it's important to emphasize that most men who have early prostate cancers actually do not have symptoms, and the first thing that's found is actually an abnormal PSA blood test as part of their health screen. Conversely, older men may have symptoms with their urination, such as difficulty starting the urination, dribbling, and sometimes they may put down their symptoms to old age and enlarged prostate and confuse it with actually a prostate cancer symptoms. So I would suggest that any man with a change in his symptoms, all right, something that is different than what they usually experience, should discuss with their doctors. And even men without symptoms, if the abnormal PSA level, should take it seriously. If you delay diagnosis and treatment, obviously there's a risk the cancer can progress and potentially even spread beyond the prostate, where it is no longer curable. Even though we have very good treatment for stage 4 prostate cancer, in recent years, with patients living beyond 5 years or even longer, it is still an incurable condition, and patients will have to undergo treatment for long term to keep their cancer under control.
Ya, jadi sebenarnya penting ya untuk tidak merasa sehat gitu ya, atau perlu untuk segera memeriksakan, bahkan hingga stadium 4 pun, atau di situasi yang mungkin sudah genting sekali, bahwa kanker prostat itu masih punya harapan yang sangat untuk bisa hidup lebih lama atau sehat seperti itu ya, Dok ya. Dan tentunya ini sudah menjalani pemeriksaan, sudah menjalani pengobatan. Apakah ada terapi pendukung dalam pengobatan kanker prostat seperti vitamin atau herbal?
The short answer is no. There are certain drugs that have been developed to shrink the size of prostate, not prostate cancer, just general size of prostate. But there is really no complementary medicine with good clinical data that shows better cancer control. With recent years, we actually have lots of new treatment that has come into our clinic. For example, we have targeted therapy that can be considered for prostate cancer patients who have underlying genetic mutations that cause their cancer to grow. For this reason, we would routinely discuss genetic testing for patients with stage 4 prostate cancer in particular. There are also newer oral hormonal treatment with much less side effect and much better efficacy, with very little drug-drug interaction side effects, which we have in our clinic as well. And increasingly for patients who have prostate cancer that has stopped responding to hormone treatment, we are considering a new class of treatment called radiopharmaceuticals, where a radiation emitting compound is attached to a protein that's seeking the prostate cancer cells when it's injected, and it will release the radiation directly where the prostate cancer cells are. So there are lots of new treatment for prostate cancer in our clinic in recent years, but unfortunately there is no complementary medicine with very good efficacy data to support concurrent use.
Oke, baik dok. Tentunya dari segala bentuk pengobatan, pemeriksaan, ataupun yang lainnya juga bahwa yang lebih baik adalah mencegah ya dok ya. Nah, ini berbicara soal pencegahan. Sebenarnya gaya hidup yang seperti apa yang harus kita adopsi gitu dok untuk mencegah atau mengurangi resiko dari menderita kanker prostat?
It will be general advice for everyone, including healthy lifestyle in general, which is regular exercise, maintaining healthy body weight. Plus, in terms of diet, there may be a slight benefit if you reduce diet that is very high in animal fat. Okay, you can have meat intake, but a diet that is very high in animal fat sometimes has been linked to slightly higher risk of prostate cancer. Last point is we do not have any data that prostate cancer risk is any different with sexual activity or sexually transmitted disease. So we have no specific advice on that. We do not have strong data to suggest a strong link between cigarette smoking and prostate cancer, even though cigarette smoking has been linked with many cancer in our body.
Oke, tentunya pertanyaan tadi mengenai gaya hidup yang sebenarnya harus kita adopsi untuk lebih baik dari sekedar meriksa pengobatan ya untuk mencegah ya. Jadi kita harus atur pertama kali dari gaya hidup kita dengan gaya hidup sehat tentunya ya. Bukan hanya cuma kanker prostat, tapi semua juga bisa terhindari segala penyakit. Tentunya terima kasih Dr. Wong Siew Wei sudah bersama kita kali ini. Semoga sehat terus dok.
Oke. Stay healthy. Terima kasih.
Terima kasih dok. Ya baik, itu dia obrolan kita Sobat Espos ya bersama dengan Dr. Wong Siew Wei dari Parkway Cancer Centre Singapura. Tentunya semoga tadi membuka wawasan kepada kita, dan bahkan dokter juga bilang atau mengatakan kepada yang saat ini sedang mengalami cobaan terkena penyakit kanker prostat dalam kondisi apapun, bahkan dalam kondisi terparah pun sudah didiagnosa terkena stadium 4, harapannya masih ada dengan tentunya pengobatan yang terbaik dari Parkway Cancer Centre Singapura. Dan tentunya saya Rizal Falevi pamit undur diri. Sampai berjumpa di episode berikutnya. Sampai jumpa.